Hello and welcome to Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss kidney stones, a very painful condition that affects 1 out of 11 people at some point in their lives. But what causes kidney stones? Can we do anything to prevent them? How do we know if we even have them? And when we do get them, what do we do? To answer these questions and many more, we turn to a true expert. Dr. Margaret Knoedler is an assistant professor at the University of Wisconsin School of Medicine and Public Health. She received her medical degree at Tulane University School of Medicine and subsequently completed her urologic residency at the University of Wisconsin. She then went on to obtain an endourology fellowship at the University of Wisconsin under the guidance of Dr. Stephen Nakada. Her clinical interests include complex stone disease, benign prostatic hyperplasia, with specialized training in holmium laser enucleation of the prostate, or HoLEP, as well as robotic surgery. And now, without further ado, I bring you a conversation with Dr. Margaret Knoedler about kidney stones. Hello and welcome to Better Man Clinics. Today we're going to be talking about kidney stones, a problem that affects more than 1 million Americans every year and affects approximately 10% of people at some point in their lives. Now, kidney stones can be exquisitely painful. In fact, one of my patients famously put it as that the pain of kidney stones is the closest that men will ever get to the pain of childbirth. Now, that being said, what causes these kidney stones? Are some people more prone to them than others? Can we do anything to prevent kidney stones? And if we're unfortunate enough to get one, what can we do to expedite the process of passing them? And when do we potentially need to go to more aggressive measures like surgery or other interventions? Fortunately, to answer these questions and many more, we are joined today by a true expert. Dr. Margaret Knoedler is both a practicing urologist and a specialist in the management of kidney stones. Dr. Knoedler, welcome to the program.
Thank you for having me.
It's our pleasure. We have a lot of questions to ask you. A lot of the guys out there have experienced kidney stones, and some haven't, and are hoping not to. Before we jump into the topic at hand, one thing I always like to ask our experts is just to learn a little bit more about you, specifically, kind of what drove you into medicine, and specifically in terms of managing kidney stones, specifically.
Yeah, so I am a urologist at University of Wisconsin. I did a fellowship, so specialized training in kidney stones with Dr. Nakada. I really found that urology is a great field. It has great patients and great coworkers. It's got a good mix of surgery as well as clinic-based medicine. And there are a lot of new technologies, especially in kidney stone disease. We've gotten very advanced in the way that we are able to surgically treat kidney stones. And then we also have a lot of ways to kind of prevent kidney stones too. So it's a very interesting, quickly changing field.
Definitely seems it, especially in the last few years, a lot of technology growing very rapidly. Now, speaking about kidney stones, we'll start off with the very most basic. For those that don't know, what is exactly a kidney stone?
Yeah, good question. So a kidney stone is made of a hard deposit in the urine of minerals and salts. So I don't know if you remember when you were a kid, but we used to have to do these experiments where we had fluid and we would put salt in and it would dissolve until it would kind of precipitate out and you would get hard crystals. And that's pretty much what happens with kidney stones, but it happens in the urinary system, in the kidney, where it forms, and then it can cause problems.
Got it. Now, are all these kidney stones made of the same minerals and salts, or are they kind of different?
Yeah, so a lot of people might say, "Hey, is there just one way to treat kidney stones, one magic cure?" But kidney stones actually represent a couple different disease processes. So there are different types of stones. Calcium stones are the most common. Most people that get their first kidney stones when they're in their 50s or 60s tend to have calcium stones. But there are a few other types of stones. There are uric acid stones. There are struvite stones, which are caused by infections. And then there are cystine stones. And then there are a few other very rare stones that we don't see very commonly.
Now, I had mentioned in the introduction that about 10% of people get kidney stones at some point in their lives. Is there something that predisposes the kidney stones in these people? Again, you mentioned it's just crystallizing in the urine. Are some people more predisposed to kidney stones than others?
Yeah, it's a great question. So there definitely are some risk factors for kidney stones. Some people, it runs in their family. And so they might have either a genetic predisposition, or they might kind of secrete certain minerals or salts in their urine more than other people. And then there are a couple other risk factors. Men are more likely to get kidney stones than women are,
Hmm.
although that gap is closing kind of in the recent past. Obesity is a risk factor for kidney stones. Um, and then being dehydrated too. So one of the things we tell all our patients is it's really important to drink lots of fluids to stay well hydrated.
So, obesity often gets a bad rap, right, for cardiac disease, diabetes, and whatnot, and the mechanism is more clear there. Can you shed some light as to how obesity may contribute to kidney stone formation?
Yeah, so it's not as clear of a mechanism in kidney stones, but there are certain factors that can increase the likelihood of kidney stones that are associated with obesity, such as insulin resistance. People who have a very high salt diet can increase the risk for kidney stones as well.
Got it. And then speaking of diet, are there other elements of the diet that contribute to stones? Like me, people always talk about calcium, calcium, calcium. So the initial knee-jerk reaction is I'm just going to cut all dairy out of my diet. I'm not going to ever consume any calcium, and I should be home free. Is that the general approach, or what elements of the diet of people's diet really can make kidney stones more problematic and an issue?
Yeah, that's a great question that I get a lot. And I often have to tell my patients, please don't cut calcium out of your diet. So even though the stones tend to be made of calcium, it's not really the amount of calcium in your diet that is causing it. So it is really important to kind of get a workup for your kidney stones to kind of see what your personal risk factors are for kidney stones. Because as I said earlier, it tends to be different disease processes that cause kidney stones, and not everyone is the same. So it's not so much the amount of calcium in your diet, but it's often increased salt in your diet will increase your risk for kidney stones.
Mhm.
That's very basic, but there are kind of 100 different kind of risk factors in the diet that could increase your risk for kidney stones.
Got it. Now, nobody wants to get a kidney stone for sure. And you mentioned some people are more prone to them. Um, I guess the first question is, how can someone even determine if they have a kidney stone before they have any symptoms? Or should they?
Yeah, so we don't really have guidelines uh, for screening for kidney stones for specific patients. I know some people get, everyone's supposed to get a colonoscopy when they're a certain age. We don't really have something like that for kidney stones. For kidney stones, we kind of get suspicious if there are certain things going on, and that would prompt us to work people up for kidney stones. That would include kind of pain in the back or kind of over the kidney area, blood in the urine, or if your kidney function is getting worse. And then also sometimes if someone's having recurrent urinary tract infections and we can't figure out why, can't get rid of them, that kind of prompts us to do a workup for kidney stones.
Got it. Now, a lot of people talk about kidney stone pain is pretty specific. It's kind of it's a very kind of unique type of pain. Can you describe it a little bit? Just because, I mean, everyone's got an abdominal pain or they have a stomach ache or they pull their back or something. They know what that feels like. How is kidney stone? What do kidney stones feel like when you're passing them?
Yeah, so there is a very specific kind of type of pain that we always think about with kidney stones. And that's kind of pain in your mid back on the side, either the left or the right over the kidney. And it's this kind of stabbing pain that doesn't go away. Sometimes it radiates or kind of moves down to your low abdomen. For men, sometimes you even feel it in the testicle. And it's often if the patient will be kind of trying to move around, get comfortable, but no position kind of it makes the pain better.
Yeah, that's a pretty common one. The kind of wiggling around and just nothing really makes it better. Now, do all people feel pain when they pass stones?
Not everybody does. So, that's kind of the typical patient that we see coming into the emergency department with kind of an acute pain episode from kidney stones. A lot of people that have kidney stones kind of sitting up in their kidney, they don't actually have pain from the stones. And if they're small enough, they could sit there their whole lives. They would never know it unless they got an image, and they never cause problems. It tends to be when you start passing a stone or the stone kind of falls out of the kidney into the ureter, which is the tube that goes from the kidney down to the bladder, that that you get pain. But even then, some people don't have pain in the ureter.
So this might sound like a weird question, but why does the passing of the stone in that ureter, the tube between the kidney and the bladder, why does that? Why do kidney stones hurt so much? I mean,
Yeah.
they're only these little poor little deposits of calcium or whatnot, or minerals. Why are they so painful?
Yeah, great. Yeah, I wish they weren't. But it's not actually the stone passing that causes the pain, but it's the stone kind of getting blocked in the ureter and not letting the urine flow properly. So when it blocks the ureter off, it kind of makes the kidney swell with urine, and then you've got these pain receptors in the kidney that kind of are going crazy and send a bunch of pain signals to your brain. So it's really the not draining your kidney that causes the pain.
So it's that back pressure kind of causing it. That makes a lot of sense. So that is that why most people, if their stone is just sitting in their kidney, they're not mostly getting too much pain because it's not really causing that back pressure. Is that right?
Yep, exactly.
Got it. Now, if somebody starts passing a stone, do most of them pass naturally? Meaning you don't have to do anything about them?
Yeah, I wish. Sure my patients would wish that too. Yeah, so there are a couple factors that determine whether a stone is going to pass on its own. The two biggest ones are size and location. So smaller stones have a higher chance of passing on their own. And if you catch the stone kind of when it's entered the distal ureter or the bottom part of the ureter closer to the bladder, they have a better chance of passing than if you start having pain when it's in the proximal ureter. So,
Sorry, go ahead.
oh, I was going to say, I usually tell my patients if you have a 5 millimeter stone, you have about a 50% chance of passing it.
Got it. No, that's a good what is the general, just for people to understand, what is the general range of size of kidney stones that make it into the tube, into the ureter, for instance?
Yeah, so most stones that kind of make it into the ureter are between 1 millimeter and 10 millimeters, or 10 millimeters is 1 centimeter. Most 1 centimeter stones are not going to pass on their own. Most stones 2 to 3 millimeters will pass, but everyone's a little different. So if someone's passed a lot of stones, sometimes they'll pass larger stones. If someone hasn't passed stones before, it might be that a small stone causes a lot of pain and isn't going to pass on its own.
And I guess it makes sense, even if a larger stone has made it all the way from the kidney almost into the bladder, then it has a better chance than if it was stuck way up next to the kidney up top, right?
Yep, exactly.
So we're going to put ourselves in a situation. Okay, we firmly believe we're passing a kidney stone. And we're at home. What steps can we take to help this little guy make its way through as quickly as possible?
Yeah. So there are a couple things that you can do. There are a couple. One thing that I tend to tell patients is stay really well hydrated. The more fluid you have, the more it's going to kind of flush that stone out. One medication that I often prescribe is called Flomax, or tamsulosin is the other name for that. And that helps dilate the ureter and helps it pass. And then as far as pain control, usually I tell people to take NSAIDs. That would be ibuprofen or Aleve. And that can help with the pain and the pain receptors. Sometimes we'll give opiates, but NSAIDs tend to be kind of the best first line pain medication.
And you mentioned hydration, which is obviously great. Can you give, and obviously it's going to vary based on your medical conditions, if you have heart disease, but for the general average healthy person, what is considered, if you're passing a stone, a good amount of hydration, if you have to quantify it?
Yeah, so I usually tell people to always have a water bottle next to you. I do too. So our guidelines do tell, yeah, there you go. Our guidelines do tell us that patients should have or make about 2.5 liters of urine a day. So that is different for everybody about how much fluid you should be drinking. If you live in a dry climate and are outside a lot, you're going to have to drink significantly more than if you live kind of in a cold area or a humid area.
Got it. Well, that's a good rule of thumb. Now, oftentimes we hear, especially online from Dr. Google, about home remedies for passing stones. I'm going to mention a few to you to get your thoughts, and then also hear if you've heard any. One thing that I've heard is about beer, which, if nothing else, if it's not going to help you pass it, at least maybe it'll help you tolerate it better. But have you? People swear by this, that they just need to take it. They say, "Doc, I just need to have a 6-pack of beer, and I'll be great. I'll pass it right away." What are your thoughts on that? Have you had any experience with beer and kidney stone passing?
I'm actually surprised I haven't heard that before, considering I live in Wisconsin. But but there have been a couple studies that have looked at this. And beer beer on its own is not something that really has been shown to help pass kidney stones, but beer as a fluid, or just like water, the more beer you drink, the more water you drink, kind of the more you have fluid to kind of flush through the kidneys and flush out the stone. So I wouldn't say it's specifically the beer, but it's just you're increasing your fluid intake, which is good for passing a kidney stone.
Got it. And similarly, another one that really people swear by is apple cider vinegar. What's the thought on that? Or is there
Yeah.
one?
Yeah, that's a good one. Because I think there is a lot of interest in that in the recent past. So apple cider vinegar does provide an alkaline load, or makes your urine less acidic. So that can help kind of prevent kidney stones. But that being said, you can kind of get a similar alkaline load with fruits and vegetables. So if you like the taste of apple cider vinegar, it's not bad for you, but it's you can kind of get the same effect if you just want to eat healthy and eat a lot of fruits and vegetables.
But the apple cider vinegar wouldn't necessarily help you pass a stone that you're acutely passing. It's kind of sounds like it's more for preventing future stones, I guess.
Yeah, exactly.
Got it. Any other home remedies that you've heard of that you think might actually be helpful if they're passing a stone at home?
Not that I've heard of. Yeah.
Okay,
Have you
sometimes
heard
you
of
have.
any of it, or what are your patients
Those are
saying?
the biggies.
Yeah.
The beer and apple cider vinegar, not often taken together, but those are the ones that they swear by. But yeah, I always thought that, like, I guess the beer, the only other thing I thought of was that maybe that it causes that diuretic effect, meaning it makes your kidneys crank out even more urine. Maybe it somehow helps. I'm just not sure that the 6-pack of beer is going to be tremendously helpful in the situation. I think drinking that, to your point, drinking the equivalent amount of water would probably be equally as beneficial in that case.
Yes.
Now, the other thing that I hear about, and this talked about a lot also, which can be confusing, is about, they say, well, if you're passing a stone, you can take some medicine to just dissolve it. What are your thoughts on that? Is there such medicine that allows you to dissolve stones? And is that medicine pertinent at the time of passing a stone?
Yeah, good question. So yeah, I do get this one a lot too. And so for the most part, you cannot dissolve kidney stones. The one type of kidney stone that can be dissolved with medication is uric acid stones. But that takes a while. So that's probably not going to be helpful when you're acutely passing in the stone. And it's not effective in all uric acid stones. You can try to take what's called potassium citrate. That's the most common thing that we give to help make the urine less acidic, which can help dissolve uric acid stones. But if you're passing a stone, it's probably not going to work fast enough that it actually kind of helps with the pain and dissolves it completely.
That's good to know for sure. Now, when you're in the process of passing a stone, I mean, this is going to vary, obviously, but generally speaking, if you're going to talk, if a patient calls you and says, "Doc, I'm passing the stone," maybe it's a 3 millimeter stone, how
Mhm.
long is this process going to take?
Yeah, so I tell people it's hard to predict. It could pass tomorrow. It could still be there in 6 weeks. Smaller stones on average, like 2 to 3 millimeter stones, on average take about 8 days to pass. A 5 millimeter stone on average is about 22 days.
Wow, it's a big difference, isn't it?
Yeah.
For sure. Now, listen, nobody likes passing a kidney stone. It's obviously uncomfortable. It involves a lot of pain. And it's a lot of times it's up to the patient, to the person, to say how much more of this I can take. But are there any hard and fast rules about when passing a stone suddenly becomes an emergency and you need to get medical attention?
Yeah, that's a good one to know and to warn patients about too. So, for the most part, it's pretty safe to pass a kidney stone. The times we get worried are if you have a urinary tract infection and you're passing a stone. So, if you start having a lot of urinary symptoms, if you have a fever and chills, don't know why, that's an emergency and you need to go to the emergency department right away. Other reasons that we would treat stones is if your kidney function is really bad. So usually it doesn't happen if you have two healthy kidneys, but if you have just one kidney and the stone's blocking it off completely, or if you have two kidneys but you're passing a stone and your kidney function's really bad, that would be a reason to drain the kidney or treat the stone right away.
Got it.
Um, Other reasons would be just if the pain just cannot get controlled at all, or if you can't keep anything down, can't stay hydrated, can't eat food because of the nausea and vomiting.
Right. And I think it's so important to know because again, people, especially guys, are like, I'm tough, I can power through it. And, pain is one thing, but you really have to be, cognizant of these very big red flags that could become life-threatening at some point, right? If ignored for too long.
Exactly.
So assuming none of those red flags are there and we're just trying to trudge along and we're managing our pain okay, but this guy is just not passing.
Mhm.
What do we do then?
Yeah, so I usually tell patients that about 4 to 6 weeks is the amount of time that it's kind of safe to try to pass a stone. After that, you can see some kind of irreversible kidney damage. So once we get to that point, we start talking about surgical interventions.
Mhm.
There are a couple different types of surgery we can do for kidney stones. We've got kind of the least invasive type and the most invasive type. Least invasive being what's called shockwave lithotripsy. It's where we put patients to sleep and kind of shock their back from the outside to kind of break up the kidney stone. That works a
So
lot better.
let me just ask you a quick question on that. When you say shock the back, what does that mean exactly?
So we have this big machine that has kind of a transducer that kind of gets pushed up against the back, and then we use shock waves to kind of target the stone specifically using X-rays, and then we have the shock waves kind of target to that one area of the stone, and then send shocks to it, hoping that it'll break up the stone.
Got it. Got it. Okay.
So that's the least invasive way to do it. It's still under anesthesia. And we can't treat all stones that way. So the next one, which is the most common type of surgery we do, especially for when you're passing a stone, is called ureteroscopy.
Mhm.
So ureteroscopy, also general anesthesia, put a camera in the bladder and then put the camera up the ureter to the stone. And then we use lasers and baskets to kind of break up the stone and then remove it from the ureter.
Mhm.
So, and then the biggest surgery that we do for kind of very large stones up in the kidney is called a percutaneous nephrolithotomy. So it's where we actually make an incision in the back, probably about an inch or two, put our instruments into the kidney, break up the stone, and then kind of suction it out. So
Got it.
that definitely a surgery where you stay overnight in the hospital, and kind of has a higher risk of bleeding and infection, but has the highest chance of getting all the stone out when you have very large kidney stones.
So that's helpful to kind of see the kind of range. Let's dive a little bit into those individual procedures. So first, we're talking with the shockwave lithotripsy. Is what as a specialist in stones, what type of parameters about the patient or the stone do you think about when you think that shockwave is probably the best option for them? Like, is it a
Yeah.
particular type of stone or size or location?
So yeah, it does depend. It depends on size, location, how dense the stone is, so kind of what type of stone it is, and then also kind of how large the patient is. So
Mhm.
it's kind of less effective when you have kind of more space between the stone and the transducer. And so it doesn't work as well for very obese patients.
Got it. So that's less beneficial. And obviously, you said you have to see it on the X-ray, right? So to be able to shock it. And then what about location? So are those mostly meant? Is shockwave mostly meant for stones in the kidney or up top, or is it equally as effective for stones that have made it towards the bladder? Where's kind of the sweet spot for those type of stones?
Yeah, good question. So it's mostly stones up in the kidney. There are certain circumstances where you can do it in the ureter as well. Proximal ureter is a little easier than distal ureter. But for the most part, it's actually stones in the kidney that it has the most success with.
Got it. And any special preparation that's required for this type of surgery?
Um, Not really. Once in a while, some people will have people do a bowel prep ahead of time, which is where they kind of take some medications to help clear out the bowel, just so it's not as full at the time of surgery. But other than that, we just need to be able to see it on an X-ray. So certain stones like uric acid, you cannot see on an X-ray, so we cannot treat that with shockwave lithotripsy.
Got it. And you said that for this procedure, people need to go to sleep. They're under anesthesia. How long does a procedure like this shockwave usually take?
Yeah, usually it's about 45 minutes to an hour.
Got it. And they
And
can go home
people,
the same day?
yep, they go home the same day.
And what are the expectations afterwards? Like, how much pain or discomfort are you expecting after shockwave lithotripsy?
Yeah, so sometimes you'll have kind of some bruising on the back, kind of where the shocks were delivered. There is a risk of getting kind of what's called a hematoma or bruising around the kidney itself.
Mhm.
That happens like 5 to 10% of the time. And so that can be a little uncomfortable. Once in a while, someone might need to be admitted to the hospital, or a rare chance of needing a blood transfusion with that.
Mhm.
But for the most part, it's just kind of some discomfort around the kidney area.
So, these shock waves, just to understand, right? You're not physically removing the stones. You're just breaking up the stones into tiny pieces and hoping they're going to pass themselves, correct?
Correct. Yeah. So you're
Now,
hoping they're small enough that they don't cause pain when they're passing.
so given that they're not being removed physically, what kind of data can you share with us in terms of success rates for this type of surgery, in terms of clearing out a stone completely, for instance?
Yeah, good question. So usually we reserve this for stones that are a centimeter or less,
Mhm.
because the success rate when they are larger than that is, sorry, 2 centimeters or less, 1 centimeter if it's kind of in the lower pole of the kidney.
Mhm.
So once you get to that big of a stone, you can fragment it, but you're probably going to be passing, fragments, and there is a risk of kind of blocking off the ureter. So we do recommend that over that size limit, you do not do shockwave lithotripsy.
Got it. But overall, like in terms of if you had to kind of just give a broad idea, if somebody's going for shock waves, what are their chance of success for clearance?
Good question. I don't have those numbers exactly off the top of my head, but it is lower than either ureteroscopy or PCNO.
Got it. So it's less invasive, but also it's not necessarily as definitive potentially as the other ones that we're going to be discussing.
Correct.
And then it's great that people go home the same day. How long would you say the recovery time for shockwave lithotripsy is, where people can go back to work and just resume all their regular activities?
Yeah, usually I say about a day or two.
Okay, so pretty quick recovery.
Pretty quick, yeah.
And what happens in that rare instance if like, let's say a fragment is bigger than we'd expect after shockwaves and it actually gets stuck now in that tube again? What happens in that scenario?
Yeah, so if that happens, we've got a couple different options. You can try to pass a stone, like we talked about earlier. If the pain's really bad, we can do what's called the Ureteral Stent, which is another surgery where we kind of put a stent from the bladder up into the kidney, and that kind of bypasses the stone and lets the kidney drain. And then we would probably come back at a different point and break up the stone. So then you would be talking about Ureteroscopy, which is the other surgical intervention we talked about.
Which was a good segue. But before we dive into that, can you explain what exactly is a stent?
Yeah. So this is an area that causes a lot of discomfort for patients, but kind of is a good tool that we have in endourology. So a ureteral stent, I kind of explain it as it's almost like a straw that's got a curlicue at the top and the bottom. And it kind of goes in the ureter. So it kind of, the first top curlicue sits in the kidney and the bottom curlicue sits in the bladder. And the goal of the stent is to bypass anything that's obstructing the ureter or not letting it drain, and let the urine drain from the kidney down to the bladder. So if you have an obstructing stone and you put a stent in, you won't have stone pain anymore, even if the stone's still in the ureter.
Now, is this stent permanent?
It's not permanent. We do take it out. It can safely be in for up to 3 months, sometimes a little longer, but it is kind of a temporary thing until we're able to go in and kind of treat the cause of the obstruction.
And then how would you remove it later?
So there are a couple different ways to remove it. So one way is we can actually leave a string on the stent. And that is kind of a string that comes out the urethra or out the tip of the penis for men. And then we secure it to the penis. And then a couple days later, when we think it's safe to take it out, then we let them pull the string, and then the stent comes out as well. The other way to remove a stent is either in the operating room or in clinic. We kind of numb up the urethra or the tube that you pee out of, and we put a very small camera in. It's about the size of a pen, but it's flexible and doesn't, there's a little bit of discomfort, but we kind of put that into the urethra, into the bladder, and then we use a grasper to grab the stent, and then we just pull it out. It takes about 2 to 3 minutes to do that whole procedure.
Got it. And while the stent is in place, you're still peeing normally. It's not like blocking your pee, or it's not sticking out of you. You don't know, it's kind of, you're none the wiser that it's in there, I'm assuming, right?
Yep. Yeah. So nothing on the outside, it's completely on the inside. So you can't see it at all. The one thing I do tell patients though, is that most patients do have some discomfort with the stent. And that discomfort tends to be urinary symptoms. So a little bit of burning with urination, feeling like they have to pee more frequently than usual. And sometimes kind of at the end of urination, they'll get a little bit of pain up in the kidney itself.
Got it. Got it. So let's move on to the next one, which is ureteroscopy. So that's very different, right? It's not non-invasive, it's non-invasive. And I'm assuming that the indications for it are kind of when the shockwave ones don't apply, meaning maybe it's a bigger stone, maybe it's you can't see it as well on X-ray, maybe it's in a different location. Is that about right in terms of making decisions about that?
Yeah. So I often counsel when they have stones in the kidney. I often counsel them that shockwave or ureteroscopy are good options. But the ureteroscopy can treat some of those other stones, like uric acid stones you can't see on X-ray. You can still treat those, and then you can treat them. Treat any ureteral stone with ureteroscopy. So you definitely are able to get to a lot more stones with ureteroscopy than you can with shockwave, although it is a little more invasive.
And in ureteroscopy, now you're actually going inside, just to clarify, you're going inside the body with the camera, and
Correct.
actually pulling that stone out. Is that right?
But we go in the urinary system, so we don't make any incisions on the abdomen.
Okay.
So people do have some kind of burning with urination the first couple of times they urinate afterwards from our instruments kind of going in and out, but no incisions on the outside.
Got it. And so it must be a very tiny camera to be able to access that little area, right? And you're putting that camera, like you talked with the stent, through the penis, the urethra, and you're going all the way up to the stone with it, right?
Correct. Yep.
Got it. And so would you consider then uroscopy more definitive than shockwave because you're actually removing all the pieces?
Yep. Yeah. So there are a couple different ways to do it. So you can, whoops. um, you can use a laser and break the stone up to very fine dust
Uh-huh.
and not remove pieces. And I often tell patients it kind of looks like you've got some like sand in your urine afterwards. Or
Mhm.
you can take a basket that kind of goes through the camera, grab the stone and pull it out. Or you can do a combination where you break up the stone into smaller fragments, use a basket, and then pull it out of the ureter.
Now, when we were talking about shockwaves, we said that there's a possibility that if things get stuck, might need that stent, the little straw. How
Mhm.
does that stent play into effect with ureteroscopy? Also kind of once in a while, or is it more commonly needed afterwards?
Yeah, that's great. A great question. It is more commonly needed. So it's not needed in every ureteroscopy, but if there's any concern from putting our instruments up and down that there's going to be some swelling of the ureter, or if the stone is very impacted, like really stuck in the ureter, even if we treat the whole stone, there's concern that there might be some kind of swelling and blockage of the ureter afterwards. So a lot of the times we will leave a stent at the end of ureteroscopy, usually for about 3 to 7 days after surgery. And that kind of gives the ureter time to settle down and for the swelling to go away so that when you kind of pull the stent out, the urine will drain properly.
Got it. And just going back, you had mentioned that for the shockwave, it's about 45 minutes. Is it about the same for uroscopy?
Yeah, so it depends how big the stone is. Usually ureteroscopy is about anywhere from like an hour to 2 hours.
Got it.
Sometimes a little shorter if it's a very small stone, but kind of depends on the size of the stone and the location of the stone.
And also under general anesthesia, usually, right?
Yeah, usually under general.
Do patients after uroscopy have to be admitted to the hospital or they can go home?
Most of the time it's outpatient. So most patients go home the same day.
And how does the recovery after uroscopy compare to that after shockwave lithotripsy?
Yeah, so after ureteroscopy, most of the pain is actually from the ureteral stent.
Mhm.
Um, Usually I tell patients after a day or two, you can go back to your normal activity. Once in a while, about 20% of patients will have really bad stent discomfort, feel like they have to urinate a lot, and don't really feel up to going back to work right away. And in that case, I usually tell them, it's okay to take a week off just until the stent's out. And then
Mhm.
once the stent's removed, then they're normally back to their normal activities.
Got it. So also doesn't sound like a huge to do in terms of recovery and tolerating it and whatnot. Now, most people, though, when they start thinking about the third option, which is that percutaneous option, it seems a little bit more involved, no?
Yeah, yeah. So that is definitely a bigger surgery than the other two. It's more invasive, kind of higher risk of complications. But for bigger stones, it does tend to be kind of a better surgery. So, sometimes I'll tell people, hey, we could treat this large stone with ureteroscopy. It might take 2 or 3 surgeries versus we could do a percutaneous nephrolithotomy and just be done with it in one procedure.
So for shockwaves, you mentioned 2 centimeter being kind of at least, a high level magic
Mhm.
number. What would be the magic number or criteria, if it's not a number, to tell you, you know what, my gestalt tells me this is a percutaneous case, not ureteroscopy material.
Yeah, so 2 centimeters is kind of the cutoff for percutaneous nephrolithotomy. And, there's some gray zone in there. Our laser technology has definitely gotten better. And so, patients who are not interested in a percutaneous nephrolithotomy, doing ureteroscopy is a reasonable option. But based on our American Urologic Association guidelines, kind of 2 centimeters is the cutoff for percutaneous nephrolithotomy.
Mhm.
There are a couple exceptions to that. If the stone's in the lower pole kidney, you can consider it for smaller stones, like 1 centimeter stones. And then
Mhm.
there are a couple other reasons why you would think about doing a percutaneous nephrolithotomy instead of ureteroscopy. Those include if they're infectious stones. It's really important to get every kind of fragment out for those stones.
Mhm.
Um, and then some people don't have, we can't get into the ureter from the bladder. So if the bladder's been removed, or if they've got some kind of anatomic abnormality that we cannot do a ureteroscopy on, then sometimes we will need to do a percutaneous nephrolithotomy for that reason.
Got it. And given the fact that it's a bigger surgery, is there more preparation involved for that surgery? Do the patients have to do more to get ready for it?
There isn't as much preparation, or the preparation's about the same. You come in the same day, you undergo surgery, but then most patients stay overnight afterwards. I
Mhm.
usually quote patients like 1 to 3 days stay in the hospital. There are some places that are starting to send patients home the same day as a percutaneous nephrolithotomy, but it just depends how complex the case is.
And do we need stents after that as well, like the other procedures?
Yeah, so usually it's either a stent, or sometimes people will have a nephrostomy tube afterwards. So that's a tiny tube. Tell patients is about the same size as an IV that kind of comes out of the back and then drains into a bag, and where it collects your urine.
Mhm.
Um, and that both of those are temporary. Usually we leave those in for about a week,
Got
whether you
it.
have a stent or a nephrostomy tube.
And recovery for after this procedure, how does that play out in relatively speaking?
Yeah, so I usually tell people it is a longer recovery. Normally say, for the first 2 weeks, no lifting more than 10 to 20 pounds, because we did make an incision. We kind of made a hole in the kidney. We don't want you to put too much strain on your body afterwards. Normally, after the first week, their pain's a lot better. And then, after 2 weeks, I tell them to just kind of increase activity as tolerated.
Got it. So, whereas the shockwave treatment sounds pretty quote unquote easy, right? But not only from the patient standpoint, but from the doctor standpoint, it sounds like the both ureteroscopy and the percutaneous surgery involve a lot of specialized skill. Are those procedures that are done by what I like to call Joe urologist, any urologist that you can just open up a phone book for, or do they require specialized training? The reason I ask for this is that as a patient, if you're experiencing a kidney stone and you realize you need surgery, should you keep certain things in mind in trying to choose that surgeon to perform the procedure?
Yeah. One thing I tell patients is you want a surgeon who does a lot of any of the procedures that they're doing. Ureteroscopy, has been around for a long time and is a very common case in urology residency. So, almost every urologist performs ureteroscopy, as kidney stones tend to be one of the most common things we see in urology.
Sure.
Um, so most people are very confident and very comfortable with performing ureteroscopy. That being said, some more complicated patients will often be referred to specialty centers, so that endourologist or someone who's had specialty training in kidney stones can help manage them and treat them. Percutaneous nephrolithotomy, although a little more specialized, everyone in urology residency or urology training does learn how to do those. So it really depends how comfortable your urologist is with it. And, it's never a bad idea to ask, how many of these do you do? Do you feel comfortable doing this procedure? You definitely don't need specialized training after residency to do percutaneous nephrolithotomies, but it's always important to kind of ask your surgeon.
So difficult question to ask, but also when you get the answer, what and there's no right answer here, but in your experience, what's a good answer in terms of, hey doc, how many of these do you do a year? What's considered a good amount that keeps your skills up potentially?
Yeah. Yeah, great question. So, I probably do about 40 to 50 a year. I would say
Hmm.
anyone who does at least 10 a year, is kind of keeping their skills up. So,
Hmm. Same thing for ureteroscopy as well, or is that would be probably expect more, I would assume, from those, right?
I would say on average, people do more than that. But,
Mhm.
if you're doing, probably about, these are very rough numbers, by the
Sure.
way. They're not anything that I've seen in the published literature. But, most urologists are probably doing at least 20 to 30 ureteroscopies a year.
Got it. So let's say we've had our surgery, we've chosen whichever one and it worked fantastically. We chose a great surgeon, it's behind us, and boy, do we want to keep it behind us in the rearview mirror.
Yeah.
Where do we go from here? My stone is out, I'm free of stents, I'm happy as a clam, and I really don't want nothing personal, doc. I don't want to see you again. Not under these circumstances, right? Where do we go from here to keep this from happening over and over again?
Yeah, so I do like to quote this to patients just so that they know the seriousness of kidney stones. But anyone who's had kind of a stone event has about a 50% chance of having another stone or stone event in the next 5 years. So it is kind
Yeah.
of a lifelong disease. It's not something that you should ignore. Some people, it might be 10 years between their stone episodes, and they're like, I'll just call you if I need you. But for the most part, I say, let's try to do a workup to see kind of what is the disease process behind your kidney stones and what can we do to prevent them in the future.
Hmm. And so what does that workup entail?
Yeah, so the two kind of factors that we look at the most are a stone analysis. So if you've passed a stone or if we were able to get a stone during surgery, we can send it off to the lab and they can tell us what kind of stone you have. And then the other main aspect of this is called a 24-hour urine. So that's where patients collect their urine for 24 hours, send it into the lab, and then they analyze it for different chemicals. Um, they check the pH of the urine to see if it's acidic or basic, check the volume of the urine, see how much calcium's in the urine, and a couple other things that they look at. And then from there, you can kind of get a good picture of kind of what are the risk factors that this specific person has for kidney stones.
Got it. So obviously it's going to be very different for different stones. If you said calcium stones or uric acid stones or cysteine stones or whatnot, and that's obviously beyond the scope of this discussion. But if you did not have access to a 24-hour urine nor to the stone analysis, and you just had a generic kidney stone patient, you went out to dinner and like, oh, you're a urologist. What should I do to prevent kidney stones? What advice would you give them?
Yeah, so I think the most important thing, and the one thing that our guidelines kind of recommend for everybody who has kidney stones, is to stay very well hydrated.
Mhm.
And that 2.5 liters of urine a day that I quoted earlier is kind of what we recommend. So that's kind of the most important one, no matter what kind of kidney stone you have. The other two recommendations that I have that don't apply to everybody, but I think are good things just in general, is to decrease the amount of salt in your diet. That means don't put extra salt on top of your food. And then other places that salt is kind of hidden that we don't think about a lot are soups, breads. Anytime you go out to eat, there's more salt than if you were making food at home. And then citrate is the other thing that I talk about. So citrate's important. It's a good thing that helps prevent kidney stones. So that is like squeezing a lemon into your water, drinking Crystal Light. Those are good ways to get some more kind of kidney stone prevention.
And for going back to the salt issue, is there a magic number for that in terms of, I mean, not that it's kind of academic because most people aren't sitting there
Yeah.
counting the milligrams of salt, but is there something that they should just a number they should shoot for potentially?
There is. I don't remember it off the top of my head though. So I'd have to.
I'm with you on that just because of the fact that like I kind of honestly I find it somewhat useless just in the sense that I can tell people any amount of milligrams or grams and they're going to say great. They're not going to sit there in their soup and calculate how much it is, but I'm glad you kind of brought up some high salt items that they should avoid. And similarly for the citrate, which kind of, so whereas salt, I understand, contributes to stones, the citrate can actually help prevent them.
Correct. Exactly.
And then the one other thing in terms of prevention that sometimes comes up is meats. I know this is for specific type of stones potentially, but like, do you have any guidelines in terms of meat intake vis-a-vis stone prevention?
Yeah, so that one is a little more complicated, and I would say for the most part, you know, I don't want to tell people to kind of decrease healthy foods that they're eating, but red meats can sometimes contribute to certain types of stones, depending on if you have specific things that are kind of elevated in your urine. Sometimes patients with uric acid stones or calcium stones, decreasing the amount of red meat in the diet can help. But I usually wait until after we've gotten more information to tell people if they should kind of think about that in their diet.
Got it. But it sounds like the real tenets are lots of hydration, low salt, and increasing that citrate in the form of like lemon and citrus fruits really kind of would apply to most people then.
Yes. And I always think of in numbers of three. I think it's hard for people to remember more than three things at a time, including myself. So I like to stick to three things.
Perfect. Perfect. Dr. Knoedler, thank you so much for your input here. I think this is very invaluable for the guys out there that are either afraid of getting a kidney stone or have already gotten one and thinking where to go from here. Before we let you go, I'm going to ask you a question I ask of all of my experts here on Better Man Clinics. You know, Better Man Clinics, the idea is live your best life. And obviously you've reached a happy level of success. What is the secret to your success? How do you live your best life?
That is a good question. Hard work. I'm
Right.
just always trying to find a balance between work and family and kind of constantly reassessing what my goals are um, and going from there. So
It's a journey, right? And
it is. Yes.
again, thank you so much for your time. And to all the guys watching and listening out there, thank you. And remember our mantra here at Better Man Clinics: your best life is a journey and not a destination. And use every day to just get a tiny bit better. We'll see you all next time.